Why would a health system be better off giving up some control, giving up some economics to someone like Rothman Orthopaedics in the big picture?
I think the difference is that our doctors as an independent practice tend to be more productive, right? They are owners in a business that they're aligned around trying to be successful. And a lot of that's based on their own individual productivity. Whereas, in a more of a typical salary model within a health system model, you don't necessarily. And so I think what you'll see from Dr. Vaccara's paper is that the productivity tends to be much higher. The cost tends to be much lower. The downstream benefit tends to be higher for the health systems.
Welcome to the Analyzing Healthcare podcast, brought to you by Scale Community. Scale is a global healthcare-focused member network where healthcare leaders come to connect, learn, share ideas, and shape what's next in our evolving healthcare landscape. To take advantage of all that Scale Community has to offer, from expansive content to virtual and in-person events to interactive peer networking opportunities and more, check out Scale Community at www.scale-community.com. Membership options range from free to paid, so if you enjoyed today's discussion, please take a moment to sign up for your preferred membership level. Welcome to the next Analyzing Healthcare podcast by Scale Community. Today I'm joined by Christian Ellison, the CEO of Rothman Orthopaedics. Christian, welcome to the podcast.
Thanks, Jason. It's exciting to be here. I appreciate you having me.
So thank you for being here. So I'm very excited to delve into Rothman. It's a name that's storied in our market and has been around for a long time, and really has, I would say, gained recognition as a leader from clinical innovation to strategic partnerships with hospitals over a long period of time, and really before a lot of these things were the focus of the national market, predating private equity investments and predating sort of the consolidation wave we've gone through. And so really excited to delve into where Rothman is today, how you're approaching the market strategically. But maybe for those that are not up to date on the current state of Rothman Orthopaedics, if we can begin by just providing an overview of the footprint of Rothman Ortho today.
Sure. So Rothman Orthopaedics is the largest independently owned practice in the United States. So when I say independently owned, I mean doctor owned. And we are primarily in Southeast Pennsylvania, New Jersey, and Florida today. We have about 200 providers, both doctors and APPs, and a number of surgery centers and practice locations, et cetera.
And when you think about your service stack within the ortho space, your footprint, what is it that are sort of the cores to the program that you offer? You mentioned ASCs. How many ASCs do you have? Are there other aspects of your care program that allow you to provide differentiated care to your patient population?
Yeah, I mean, really, we can provide the whole continuity of care to a patient, from rehab to orthotics to imaging to ambulatory surgery. And we also have a couple of surgical hospitals in Pennsylvania. And then we have relationships with acute care hospitals for that component that are pretty tight and integrated in terms of how we collaborate and manage their orthopedic programs.
So one of the things that I think is particularly interesting about the Rothman story, and as it's evolved, has been the company's relationships and partnerships with hospitals in different markets. And so my understanding is in the Philadelphia market, you have a close relationship with Jefferson, and in other markets with other hospitals. But can you provide us an overview of how you're aligned with hospitals across your footprint in the three markets that you mentioned?
Yeah, so obviously Jefferson's our oldest relationship and probably closest relationship of any of our health system relationships. And that's probably because of our teaching affiliation with Jefferson. So we have a pretty material teaching relationship where we train residents, we lead their orthopedic program. We have a number of fellows that we train at Jefferson. But we have health system relationships in all of our markets, to include other relationships within the greater Philadelphia market. So we work with Mainline Health, we work with Atlantic Care in New Jersey, and we work with Advent down in Florida. And so health system relationships are a critical part of what we do. Part of it is because in orthopedics, they're still a key component of the care continuum for patients. We do, as part of our mission, have a significant emphasis on teaching and research, which inevitably involves teaching institutions. And health systems are getting more and more into the ambulatory community as well, and starting to get into the provision of orthopedic care from a provider perspective. They've always been there, but I think leaning in a more material way over time. And so we feel like it's important to collaborate with our health system affiliates in our different markets. And the way we do that, quite honestly, looks a little bit different market to market, as does our strategy in terms of how we approach a market. So different shapes and sizes, but all of them have been very beneficial to us over time. All of them are in a state of transition of varying degrees, just because our partners are in a state of transition and the market's evolving and moving along. And so these partnerships are fluid, but they're collaborative and important to us.
So let's talk about some of the different flavors of those partnerships. What do they look like? Are they ownership aspects where you're sharing in facilities? You mentioned about the teaching collaboration. They where Rothman is sort of managing the ortho MSK service line for these hospitals, or is it more informal where there's just admitting privileges? What is the nature of the relationship?
All of the above.
Okay.
That's that's true. I mean, we have call requirements at every hospital that we're at. And some, like in Jefferson, like I said before, it's a more material comprehensive relationship where we are providing a lot of training capabilities, where our doctors are professors at Thomas Jefferson University. We're leading the orthopedic program. We're in a number of joint ventured ambulatory facilities with them, primarily surgery centers and surgical hospitals. All of our health system relationships have joint ventured surgical facilities. So Advent down in Florida, Atlanta Care, Jefferson, both in New Jersey and Pennsylvania, Capital Health in New Jersey, Mainline Health in the Western Pennsylvania suburbs. So we have a number of JV facilities with folks across the continuum. In some cases, as I mentioned, we're managing the orthopedic program, and in others we're not. We just have staff privileges at the hospital.
So, I mean, I think it's so fascinating. For a lot of the MSO market, the evolution has been totally separate and siloed from the hospital market. And so, the relationship with the physician is either the hospital employs a physician or the providers are, again, totally siloed and in parallel. And it sounds like you found a middle ground where you're able to collaborate closely with these hospitals for coverage, for sharing in these facilities. And so I want to get into what are the benefits when you do work collaboratively with hospitals to the patient primarily. And then we can talk about the benefits of the hospital and the benefits to the physicians. So by being able to be coordinated, by being able to span not just the full stack of care services in the outpatient market, but actually transcending into the inpatient market, how are patients better off in terms of quality care, in terms of cost of care, relative to the other world where the hospital and the provider ecosystem, the provider MSO ecosystem, are either employed by the hospital entirely or entirely siloed from the hospital?
Yeah, I mean, I think it goes without saying that the more integrated and coordinated the care is, the better for the patient. I mean, I think our goal is to provide value to buyers of healthcare, so payers, employers, patients. And so to have a lower cost system and the mechanism in place to drive that, I think are important. I think we also want to remove friction in the system for patients, right? We want to make it easy for them to interact with their healthcare providers. And I think to the extent that you're integrated in some way, or at least you're collaborating in a meaningful and deliberate way, you're going to provide that to patients. And so inevitably it's going to be better. And as we all know, it's been a challenge of US healthcare historically, is the disjointed nature of the system and how care is provided and paid for. And so we're trying as best we can to solve for that. Now, the reality of it is that our health systems have their own challenges, right, that are separate and distinct from us, that they're trying to solve for through employment of doctors, and they're trying to protect themselves against changes in the marketplace and so forth. And that creates a dynamic that isn't always positive, but it's one that we need to work through together in order for our respective organizations to be successful and to do what's best for the patient.
Has partnering with a hospital allowed you to enter into new and creative types of relationships? So different types of reimbursement models that only become available when you have access to and control over the inpatient side of the business, or different types of strategic partnerships maybe with employers. Is there anything of that nature that has come about through these relationships, or does the reimbursement model and sort of the referral streams look like any other MSO would look like that's not necessarily partnered with the hospital?
Yeah, so I mean, Rothman prides itself in being leaders. Clearly we are in terms of research and training and that sort of thing, but also in care delivery models and utilization of technology and so forth, and the way we we do what we do. And so as a result, way before my time, Rothman's been involved for years in the various government bundled payment programs, as well as programs with all of our material payers in our markets around value-based care. And so I think to the extent that you have a formal relationship in place with all the providers across the continuum of care, it makes that easier. Certainly our joint venture facilities are a key part of that. And the hospitals are as well. I would say that the hospitals, it's maybe not as coordinated and organized with the hospital component as maybe it is with the JV facilities, but nonetheless, it does make it easier because you can have conversations quickly and openly and so forth about cost and how care is delivered.
From an operational perspective, is there shared infrastructure, shared teams between Rothman and the hospital, shared EMR, shared central services, or not that type of integration that you're pursuing?
Well, again, it depends. I think in Florida, we're in a PSA agreement with Advent in Orlando. So Advent is providing a number of services on behalf of the group, and then Rothman Philadelphia is providing others. And I think we've tried to take best of breed in terms of what we're both good at respectively. And clearly anything market facing, Advent is going to be stronger at, right? Because they're ingrained in that market. Rothman was new to that market. So whether that be payer relationships, revenue cycle, anything that that operates there locally, but things like patient access and things like that, Rothman leads because we have a very, very developed patient access platform. And so we're providing that service as an example. And so whereas in Pennsylvania, most of the MSO services are provided by Rothman because we have such a long history in that market. Same with southern New Jersey. And we feel like we do things, more effectively on behalf of our group than in the hospital. We do provide outsourced services for Jefferson as an example, where we're paid to provide certain services beyond the basics like call, but probably more related to things like academics and that sort of thing that they've contracted with us to provide.
Let's talk about the patient journey. Again, and it may be different in different markets, but you have this portfolio ranging from surgical hospitals to ASCs to inpatient on campus at the hospital to, I think you have some urgent cares as well, to the clinic. How do you coordinate with the hospital to make sure that the patients are getting to the right site of service for their particular needs? So, not a higher cost and not a cost and acuity are matched to the needs specifically.
Yeah, and we actually call it demand matching. That's kind of the vernacular internally, but we have a very developed nurse navigation program that's allowed us to be successful in value-based care over the years. And so that's really where it originates. So we have nurse navigators that coordinate with obviously our own providers. They coordinate with the hospital and other sites of service that may not be part of Rothman, and they coordinate with the patient in terms of helping them understand. It's helped us keep patients out of the ER as an example, post-operatively. And, a lot of the standard nurse navigator stuff that other people are doing, but I'm not sure are doing as much in specialties like orthopedics or have been doing it as long. And it's something that we take a lot of pride in and think we do a good job at.
And that nurse navigator program is owned by and managed by the Rothman.
It is.
In all markets.
It is, yeah.
So it sounds like a key to success, like a key contribution to the salad bowl between the hospital and Rothman would be the nurse navigator program contributed by Rothman. Is there anything else that you think is a key component to these successful outcomes from a programmatic perspective that Rothman is contributing?
Yeah, I mean, our goal generally is to create access for the patients, right? I mean, we want, like I said, to take as much friction out of the system as possible and to help guide them along what's a complicated journey in any specialty, and especially if surgery is involved in various aspects of postoperative care. And so we think we do a good job, not only with our nurse navigator program, but with our patient access program. Our leadership comes out of very developed customer service types of environments outside of healthcare. We're leaning into technology, particularly AI, in all aspects of our business. And, I think we hope from going from a place where we are today, which is how do we do what we do more effectively and cost effectively, to a place where we're actually reimagining how care is delivered based on how we can utilize AI. And obviously it's early days and there's just so much more we can do. And we're excited about that. And so we see that to be the next layer of opportunity for the organization from a patient service perspective.
One of the points of skepticism or maybe criticism against relationships with hospitals is that sometimes the hospitals can be quite big, they can be quite bureaucratic. So even if the MSO offers some value proposition that has a compelling value to the patient, to the market, the hospital is either too slow or has conflicting interests, invested interests that prevent it from leveraging these outpatient models. How have you found that in reality? Where do you see points of conflict and interest diversion, and how have you overcome that in your relationships with these health systems? Healthcare leaders, if your revenue cycle management is underwhelming you, it's time to rethink your current suite of solutions. Scale Healthcare's AI-powered RCM solutions are purpose-built to protect and accelerate revenue across the entire lifecycle. Denial Shield is an AI solution that proactively prevents and automates the resolution of denials, stopping revenue leakage before claims are even submitted. Front Desk Shield supports preclinical, administrative, and front-end RCM functions, incorporating eligibility, prior authorization agents to eliminate friction early in the patient journey. Revenue Shield maximizes revenue by automating coding, charge capture, and revenue integrity functions, ensuring accurate and complete reimbursement. Together, the Shield Suite helps organizations reduce operating costs, capture missed revenue, accelerate cash flow, and increase productivity without ripping and replacing existing systems. If you're ready for immediate ROI and measurable impact, visit scale-healthcare.com and see how the Shield Suite is redefining AI-powered RCM.
Yeah, I've worked in healthcare now a number of years and have worked in collaboration with independent doctors and health systems for a long time. And I will start by saying it's certainly evolved. I mean, in the early days, I think there was many more points of conflict or differing objectives. I think that's getting better as health systems recognize that they need to move into the ambulatory environment in a meaningful way for both economic and for viability reasons going forward. And so I think they've also realized that they can't do everything themselves if they want to grow quickly and scale. And so I think just generally speaking, the more sophisticated health systems are more open to partnership than they've ever been, not just with physicians, but with other organizations as well, both within the care continuum as well as the support services space. And so it's a different world than it used to be. Having said that, there's still areas of conflict. They would like to control as much of that care delivery model as they can in a lot of places. And we're firm believers that we can do certain things better. And so a lot of times that's an evolutionary process of trying to use good data and information to educate each other and try to find something that'll work. Dr. Vaccaro, who I'm sure a number of your listeners are familiar with, is our physician leader at Rothman and has really been part of the leadership team of Rothman since the group's inception and helped build what Rothman is today. But he's about to publish a paper, I think, that illustrates that a dedicated private physician group is more effective. When I say dedicated to a hospital and a health system and their goals and objectives, but independent in terms of how it's structured, how its incentives are created, and so forth, creates more value for the health system than employed physicians do. And so I think that it focuses specifically on spine surgery, but I think it's probably applicable to most specialties and most subspecialties within orthopedics. And so using information like that to be able to educate your partner around different models of care that may be different and may require change and a little discomfort, but may ultimately add more value back to the system, I think is important rather than just having an opinion.
Yeah, I mean, let's talk about that for a second. I mean, hospital executives, I think, are oftentimes challenged with management of their physician network and their clinics. And I think there's fairly broad recognition that a hospital is oftentimes not well suited to manage that broad ecosystem. However, there's oftentimes concern from the hospital that if I don't control everything, that I'm going to lose value. And you're sort of alluding to, by partnering with an entity like Rothman Orthopaedics that is capable of managing this physician network and keeping that network independent, that the hospital actually benefits. So can you walk through some of the benefits to the health system from this relationship? Why would a health system be better off giving up some control, giving up some economics to someone like Rothman Orthopaedics in the big picture?
Yeah, I mean, I think they definitely give up some control, or at least they share it. I wouldn't say they give it up. I mean, I think in a good partnership, we're all in this together. And so there should be shared control and shared decision making. And, we need each other to be successful for each of us individually to be successful. And so, while that's a little bit of a leap of faith, I think it we're definitely aligned in that regard, even though they're theoretically giving up some control there. I think from an economic perspective, I think what Dr. Vaccara's paper will demonstrate is that it's actually more advantageous to a health system to partner with an independent group, assuming that independent group is aligned with them and not multiple different health systems in a market, and or at least in certain parts of the market where they play ball. First and foremost, we have the downside economics of the relationship in terms of having to employ our own doctors and that sort of thing. And they're getting all the upside in terms of benefit of the facility economics and that sort of thing, much like they hope to gain, I think, in an employed model. I think the difference is that our doctors as an independent practice tend to be more productive, right? They are owners in a business that they're aligned around trying to be successful. And a lot of that's based on their own individual productivity. Whereas, in a more of a typical salary model within a health system model, you don't necessarily have them. So I think what you'll see from Dr. Vaccara's paper is that the productivity tends to be much higher. The cost tends to be much lower. The downstream benefit tends to be higher for the health systems, and the quality is just as good, if not better, than what you get in a health system, or at least in our experience. And so I think it's, again, using data to help them understand the potential for the opportunity.
And what's been the response from the payers to this strategic partnership? Are they rewarding you and extremely excited to work with the combined health system plus Rothman Orthopedic offering because it represents the ability to expand access and reduce cost of care? Or is it not something that they've sort of been gone out of their way to reward?
Yeah, I think it depends on their relationship with the payers, quite frankly. I'm sorry, with the health systems. I think if they're having challenges with the health systems and other aspects of their business, I think it probably would concern them that we were more aligned, particularly if Rothman or another group of our scale has a significant market presence. I think just anytime you have two strong players aligning together, it probably creates a little bit of concern for payers, or at least that's my assumption. But I think it's an education thing in terms of us trying to present value back to payers and being able to demonstrate that through data. So hopefully to get them aligned around what they're doing. But I think a lot of it starts with what the nature is of the relationship between the payers and the different health systems we're looking at potentially aligning with.
You mentioned data and technology, AI, a few times. So I'd be curious from a data perspective and from an AI perspective, what technologies you have in place to allow you to deliver care, and more importantly, what allows you to measure the outcomes and which outcomes you're particularly proud of as an organization?
Yeah, we, like a lot of other healthcare organizations, have a lot of different elements to our tech stack, and a lot of them are traditional, right? In terms of EMR and call center technology and the like, CRMs, all of that. And I would say traditionally we've worked with more of the industry players. We ourselves use eClinicalWorks as our EHR and practice management system. And they've been, I think the benefit of working with them is they've been very collaborative in terms of their development of what we need to be successful. And they've been conscious of economics and that sort of thing. But what we're finding as we go on, and not surprising, I'm sure everybody's seeing this, is there's a lot of startups that are interfacing with different aspects of the tech stack and of the patient journey to try to provide value. And it tends to be focused mainly on AI. So we're working with a bunch of different providers in that regard. And evaluating new ones all the time. And particularly if they'll help us make that leap from just doing what we do better to reimagining how the care is delivered. So it's an evolution. And I would say, while we're proud of what we've done to date, I think we feel like there's a lot more that we need to do to be successful. One thing we've been very deliberate about, and I don't know if it's necessarily driven by technology, it's certainly facilitated by technology, is just our data. I think it's probably more of a product of us leaning into value-based care and knowing that we need to understand our own data from a quality perspective, from a cost perspective, from a patient sat perspective, et cetera, and be able to convey that data. And so I think it's kind of forced us to capture that data and organize it in a way that makes sense. And I think we also benefit from being a very integrated group historically, kind of top to bottom. It's not for instance, just to use a different example, an IPA or or a private equity backed type organization where they've bolted on a bunch of disparate practices and they're trying to build that scale. We've been able to just build it under one common brand and one common set of operating processes and procedures and so forth. And so I think it's enabled us to capture data that we can then utilize in an effective manner.
I remember the topic of integration was always very important with Rothman. And, my recollection from talking to one of your executives a few years ago was that when you diligence an acquisition, there was a heavy focus on integrating the IT systems and standardizing the workflows, standardizing the IT systems for purposes of getting a network-wide culture and identity, but also from a data perspective. So it sounds like that's remained the case across your network.
It has, and that's one thing I actually learned in my past role, which was leading an ophthalmology, private equity-backed ophthalmology platform that was scaled among a number of different states. And we, grew through acquisition initially. One lesson learned for me is probably to have integrated systems earlier. I think we were very, I wouldn't say hesitant's the wrong word, but we were cautious about taking away doctors' EMRs as an example. And in fairness, in a model like that, and where that's your growth model, there's trust building that has to happen first and that sort of thing. But I think we would have been much stronger, much faster on a bunch of different dimensions to include profitability if we had integrated more quickly from a process and technology perspective. So that's a benefit Rothman has in its current footprint. But as we expand, that might be a challenge that we're going to have to consider.
I was going to ask you, we see a lot of MSOs that have reached a certain level of sophistication and scale that have moved beyond that structure, for better or worse, to, for example, creating their own clinically integrated networks that have avoided the CapEx that comes with acquisition, have reduced sort of the barrier to growth, and have allowed these organizations to build a bigger footprint when they go back to the payers to talk about value-based care, alternative reimbursement arrangements. It sounds like Rothman has shied away from sort of the clinically integrated network type growth model. Is that a fair statement?
So far, I think as we move forward, each market is so different in terms of the practice economics, and a lot of that's driven by the payer environment, that it's difficult to have one group as you span geographically, particularly to different regions of the country. And so I think what we'll look to do is where are there areas where we can benefit from scale. So whether that's on the cost side or the technology side or the patient acquisition side, but how can we bring value to local practices that aren't in our geography and value then back to the patient as well, without necessarily fully integrating the physician organization itself. And that's worked out well for us in Florida. We have a common brand, but it's really a different group but common MSO structure that sits on top of it. We've learned, as you mentioned, we've expanded into the greater New York area and then ultimately pulled out of there. And it wasn't because it's not an attractive market or we didn't think over time we could be successful there. But I think we learned some lessons through that expansion where we might want to retrench and figure out how to do it differently next time around. And we've tried to apply those in Florida. Similarly, things have gone largely well in Florida, but there are things we'd do differently the next time around. And I think we consider ourselves a learning organization. We're trying to adapt the model as we go. And there's no one size fits all from our perspective.
Well, I think it's very interesting and a good segue to talk a little bit more about Florida. Rothman organization has been in the Northeast, Philadelphia, New Jersey for a long time, and has really developed a special business with a pretty wide footprint. And so then the question is, how scalable or exportable is that model? And for a lot of companies, that's a tough transition to make. And maybe they do it through deploying a lot of capital and moving into a lot of different states through acquisitions. But you've done it with your deploying, this model of a hospital partnership in a second market in Florida. And so talk to us about how that Florida market expansion came to be, a little bit more about how it's similar or different from the experience in the Philadelphia, New Jersey market. And then what are your thoughts on how exportable it is to a third market, a fourth market, a fifth market?
Yeah, so the Florida opportunity came to be because Advent had some market construct issues with their orthopods in that market, where the major group in that market ended up aligning with one system at the expense of Advent. And so they approached us about partnering. And this was before my time, so I may get a few of the facts wrong, but I think I largely understand it. about building out a group from scratch, more or less. And so we were able to, over a 3-year period of time, expand from basically 0% market share to 30% market share in that market. And I think we have about 45 or so doctors and APPs in that market, and a number of different locations in a surgery center, all that we developed with Advent over a 3-year period, really from a standing start. Rothman, as you know, brands don't typically travel market to market unless you're, Kaiser Permanente or, one of the strong national brands, HCA. But at least from a patient facing perspective, the Rothman brand didn't mean a lot in Orlando, other than people that may winter there from the greater Philly market. But where it does mean a lot is to doctors. And so we have a really strong brand with doctors. And I think recruiting doctors is one of the challenges of any physician organization or health system recruiting doctors. It's, there's just a supply and demand imbalance, as we all know, that's never going to be solved for. And I think one of the things that attracted me about working for Rothman is that we produce our own doctors every year through our residencies and fellowships. And that, I think we proved out that added a lot of value as we tried to stand up this group for Advent from a standing start. And so, of course, there are some local providers that became part of that, but a lot of them were either from the Rothman alumni across the country, or they were doctors that we were producing right out of our programs. And so that gives me a lot of optimism for our ability to expand as we go forward in the future, and also for our own market, as we still think there's a lot of growth in our current core market of Southeast Pennsylvania and Southern New Jersey. And our ability to retain doctors out of our training programs are going to be key to our success there as well.
Have you replicated that training program feeder ground in Florida, or is that still coming mostly from the Northeast?
No, I mean, I think we're trying to collaborate with the Florida group around research, around training, et cetera. So yeah, I mean, that's one aspect of the group that we would hope to replicate. One thing, I mean, obviously we've utilized our brand in Florida. In some markets, we may not. There may be a strong local group that we align with that it makes sense to retain their brand or create some sort of affiliation. But I think what we do want to make sure is that there's cultural alignment, and that their approach to, if we do align with an established group, that they have shared values, they align around research and education as well as great care provision, and so that we really have similar DNA going in, because as you know, I think in any business, most acquisitions fail, and a lot of it's cultural. And if we can start with the right partners, I think those will have a greater likelihood of success downstream.
Well, I think it's the brand topic is so interesting. I mean, like this theme of strategic partnerships, brand is an evolving concept in our MSO market, and a lot of organizations really have not invested heavily in the corporate brand. They preserve the local market brands where the patients have familiarity with their doctors. The MSO has sort of had a name, but it's mostly been hidden. And I think that's beginning to change, perhaps, with some of these organizations that have achieved a certain level of scale and maturation. Rothman has been a big investor in its brand over a period of time. And it sounds like, at least in Florida, it's helped to have that credible brand that is recognizable, if not to the patients, at least to the providers. So it's interesting to hear that it was a strategic chip. I think something for other MSOs to think about. But it's also interesting to hear that there may be a reversal of that course in other markets if you move into a new market through acquisition and you bring on a reputable, credible brand in that other market.
Yeah, I mean, I think our bias is to use our brand. I mean, we believe it's strong. I think what we've demonstrated is that we can go, and this is from a patient-facing perspective, we can go to a place where we had no brand, and now it's a strong brand in the market. I mean, we're the sports doctors for the Magic in Orlando and a number of different teams. And I think patients can identify with Rothman now, and it didn't take long. It took 3 years, and we were a material brand in that market. And so I think any fear for us of us having a non-recognizable brand, we were able to alleviate over time and kind of leverage our brand in that market. And I think part of that's just how we do what we do. So our bias, I think, is to use our brand. But I think at the same time, we want to be open-minded. Every place is different and every market's different. And some groups have you're not aligning with them unless they have a strong history and their brand resonates within the market. And so I don't know what it'll look like, but I do know that it will likely look different everywhere.
When you think about the next 3 to 5 years for the Rothman Orthopedic organization, what are you most excited about? And do you envision a continuity of strategy? So, one market at a time, gradual, maybe you add a third, but you're probably not going to be in 5 to 10 markets in 3 to 5 years. Still heavy focus on alignment with the hospital in a given market. Or do you see more likely that Rothman Orthopedics is going to take a different approach in the foreseeable future?
Yeah, as we think about our growth, I think I mentioned earlier, we feel like we have a lot of opportunity in our core markets first and foremost. And so I think if I were to chart a 5-year trajectory here, I would say if you look at the first 2 years, we're going to focus on just being the best at what we do in those markets. And at the same time, that'll be shaping our capabilities so that they're in a position so they can go out and be ported elsewhere and be able to add value in new markets where we go into. And I think we'll also then look at, as we go out in time, we'll look at adjacent markets where it's not too big of a leap for us to, from both a brand perspective, from a support perspective, and so forth, to be able to continue to expand our influence on the market and impact more patients. And then, as I look out into, say years 4 and 5 of that trajectory, we'll be very selective. But are there other places within the U.S. where we can help independent groups establish durability and growth over time? And one of the things I was most excited about is the fact that Rothman is an independent group. And as we all know, physician-owned businesses are going away very rapidly. And there aren't many that exist today. And if we can put ourselves in a position where we can help doctors in other places retain ownership and control of their provider organizations, we'll feel like we're giving a lot back to the physician community and to the future physicians entering the profession, and we can be a thriving player. And so we hope to reverse that trend in orthopedics anyway, and start helping to pull it back the other way. So that's kind of how we're thinking about the next handful of years. And we'll be opportunistic about opportunities to work outside of our core market in the early years, but we're just not going to be deliberate about it.
Last question I have is maybe just taking a step back and offering some advice to your peers, whether it's in orthopedics or whether it's in other specialties, about the topic of hospital partnerships. Are there particular specialties where you think hospitals would be receptive to a similar type of partnership? We hear cardiology come up a lot. Are there other specialties where you could see a similar model as what Rothman Orthopaedics has built being rolled out? And then what would you say in terms of conditions that are conducive to success with the hospital relationship, attributes of that hospital, attributes of your own organization that are sort of necessary conditions for a successful relationship with hospitals?
Yeah. So in terms of the specialties and so forth that are more conducive to partnership, and I'm not a health system exec or a hospital exec, and so I may not know what I don't know in that regard, but it appears to me anyway, just looking at orthopedics, that it's the care that's traditionally been provided largely in an acute care setting that's now starting to migrate to an ambulatory environment. And the payers and other buyers of healthcare and doctors, particularly independent ones, are going to start to pull that stuff out of acute care settings. And so if you're a health system, I think you're well served from, at a minimum, an economic perspective, but also a continuity of care and a market share growth and a patient satisfaction perspective to try to align with those provider organizations in some way, because it's going to, in my opinion, it's going to come out of the acute care setting. And so it's better to be part of it than not. So, it's probably anything like cardiology, oncology, obviously acute orthopedics. And so that's how I would, neurosurgeries, kind of part of that, I think. And so those would be the specialties that are likely to happen. I think in terms of what makes a desirable partnership, I think one of them, obviously, if I'm looking at potential health system partners, but ones that have a track record of success in partnerships with doctors, and where it's part of their DNA to partner and align with doctors or other organizations, where they've recognized that they don't need to be everything to everybody. And so inevitably they're going to come in up the learning curve in terms of how to have a successful partnership, and they're going to approach it in the right way. And they're going to be the type of organizations that you can work with along the way when things get tough and you have to pivot or have some hard conversations and work through challenges together. So that's what I would say about that. I think in terms of physician organizations, I mean, you need strong physician leadership is first and foremost. I mean, none of us, I will never be the leader within Rothman Orthopaedics or any other physician organization that a doctor, even doctors that aren't in formal leadership roles. I mean, they have so much influence on how we do what we do, how our message is received from our teammates within the organization, how it's communicated to hospitals and health systems, right, from day-to-day employees all the way up to leadership. And so having a strong physician leader that believes in what we're doing from a partnership perspective is kind of critical to that, the first place to start. So I think that's a key component. And then probably the second one, just as an organization, is just to be good listeners and try to put yourself in the shoes of your health system partner. And it doesn't even need to be health systems. Whoever you're partnering with, try to look at it, whether it's maybe another physician organization, but try to look at life through their lens and the challenges and what they're going through. And you try to, or opportunities that they have, aligning with you, either help solve their problems or capitalize on their opportunities, and think of it through that lens, not necessarily what you have to offer them.
Yeah, I mean, I'm just thinking of a follow-on question. So maybe one more. When you think about all the benefits that this relationship offers, the core disciplines that Rothman Orthopaedics has brought to the table, like the nurse navigation program, the footprint that Rothman Orthopaedics has added on to the hospital network out in the community to expand access and just create sort of this hub and spoke model. And the list goes on. The teaching relationships, the research, the training program, happy physicians that could be retained. You mentioned Advent sort of had a dynamic where they may have lost some physicians, and so they've used this relationship to help make them more competitive in retaining providers. Are there scenarios where hospitals really should do it all in-house? They should own the hospital site of service, and they should build out their own employed network of physicians? Or should we as a market in general really be targeting something much more like this partnership model, where you have the hospital that has what it does well in its core discipline, you have the provider organization that does what it does well. These things work in collaboration, but they are managed somewhat independently.
Yeah, that's a tough question. Certainly, there are those that do it well and have done it well in terms of being completely vertically integrated. I think those that do it well are ones that have started that way, and it's just who they are. KP is an example of that, right? And then they've just been very selective in terms of the markets that they've gone into, and they've stumbled. And I can't speak for them, but when as a casual observer, some of the ones they've had challenges in are where they've tried to fit their model on a market or try to fit into an existing dynamic. And so, but I think if you're starting from scratch and you have a model that you've fine-tuned and culturally that's the way it works, I think it can work. I think by and large, though, the way patients enter the healthcare system is complex and variable. And I think it's just very difficult for you to be everything to everybody, for you to have all the primary care locations, all the necessary primary care providers that you need to provide access, all the urgent care sites, just all the different points of access into the system to meet the needs of a patient population. So I think to the extent that you can partner with others to increase that impact on the marketplace and create more access points for a patient, you're going to get the benefit from that downstream, both from a financial perspective and otherwise.
Yeah, look, I've had the pleasure of meeting with CEOs from different specialty organizations. And one of the things that comes across in all these conversations is how intricate the care stack is to really excel within a given specialty. And so you and your entire organization wake up every day thinking about how to deliver the best orthopedic care. Your peer in cardiology wakes up every day thinking about how to deliver the best cardiology care. And you've built out all these custom, components to your business, from the data to the care programs to the sites of service. And I think it's just it's very difficult to match that level of comprehensiveness and excellence without being very focused. And so if you're a hospital system, and you're focused on all these different specialties, how do you get that level of excellence across the board? And I think that's very, very tough to do. So I'm excited for the emergence of more organizations like Rothman Orthopaedics that are as well organized, as sophisticated, as ready to be partners, because I think there's a lot of value to be created in the market through the collaboration between hospitals and these MSOs of that level of sophistication and quality.
Yeah, it's you made a very interesting point. I mean, every once in a while you get tempted to do other things. So if we do something really well within the sphere of orthopedics, is it applicable to other specialties, and does it create a new revenue stream, or whatever the case may be. But the bottom line is the reason we're so good is because all we do is orthopedics. And I think just having the discipline around that when there's so many opportunities to add value, and it doesn't have to be us, it can be anybody that's really good at what they do. I think having not having too big of eyes and having the discipline to stay focused is important. And then that's how you create value back to the market.
Christian, I want to thank you so much. Wonderful discussion, incredibly insightful. So I really appreciate you taking the time to stop by.
Thanks, Jason. I appreciate it.
Thank you for joining us on Analyzing Healthcare. Stay informed and stay inspired. Don't forget to subscribe and visit scale-community.com to become a Scale Community member. Until next time, keep exploring the ideas that shape our healthcare systems.